Hi, my name is Maria Esther Montero Moreno, and I'm gonna read the exercises 24, 25, and 26 of the book Professional English in Youth Medicine. Exercises 24, exercises chapter 24, infectious. Exercise 24.1. Match the two parts of the sentences. Look at A, B, and C opposite to help you. 1. 1988 saw the UK launch of Leaf, attenuated. J. Measles, mumps, and rubella, MMR vaccine. 2. Chickenpox, varicella is a common infectious E. disease of childhood. 3. Rabies has an incubation A. period ranging from 4 days to many months. 4. The patient remained febrile H with peaks of temperature of 39.5 degrees Celsius. He was admitted with a 4-day history of influenza-type symptoms of fever with P. rigors, myalgia, and general malaise. 6. Quite a proportion of patients who recover from hepatitis B, C become carriers of the virus. 7. The central part of Africa is in the midst of an epidemic F of AIDS. 8. Measles rubella is most D. infectious during the catarrhal stage. 9. Lyme disease is caused by transmission G of B or dorsally from animal to man by isotetids. 10. PUO stands for E for I. Pyrexia of unknown origin. Exercise 24.2. Complete the case report on the patient in A opposite. Look at A, B, and C opposite to help you. Case 45. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Exercise 24.3. Complete the sentences. Look at A, B, and C opposite to help you. An infection which can be treated successfully with antibiotics is curable. Another word from epidemic is an outbreak. Bacteria and viruses are examples of microorganisms. Someone whose temperature is normal is afebrile. The common infection with Epstein-Barr virus is known as glandular fever. Exercises 25, mental illness. Exercise 25.1. Complete the table with words from A, C, D, and E opposite. No, an adjective. No, affect, adjective, affective. Anxiety, anxious. Behavior, behavioral. Dementia, demented. Disturbance, distort. Suicide, suicidal. Suicidal. Exercise 25.2. Make word combinations using a word from each box. Two words can be used twice. Look at B, C, and E opposite to help you. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, substance abuse. Exercise 25.3. Complete the sentences. Look at A, C, D, and E opposite to help you. The way a person behaves is his or her behavior. 2. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with aging is called senile dementia. A disorder which is not associated with pathological changes is functional. An idea which forces a patient to repeat unnecessary actions is a compulsion. Exercise 25.4. Which symptoms of depression was this patient suffering from? Look at C opposite to help you. Case 41. A 56-year-old man, a 50-year-old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. The patient has tiredness, loss of interest, and insomnia. Chapter 26. The nervous system 1. Complete the table with words from A, B, and C opposite. Adjective, no. Adjective, blind, no, blindness. Conscious, consciousness, deaf, deafness. Dizzy, dizziness. Numb, numbness. Height, light-headed, lightheadedness. Unsteady, unsteadiness. Exercise 26.2. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Double vision, epileptic fit, prodromal symptoms, syncopal attack, urinary incontinence, visual visual acuity. Exercises 26.3. A doctor is trying to determine the cause of love of consciousness in a 52-year-old man. Complete the doctor's questions. Look at the opposite and at the table in 2026.1 about to help you. Did you lose consciousness suddenly or gradually? Did you get warning of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your did your wife notice any involuntary movements while you were unconscious?